Welcome to the Body Ethos Podcast, where we're shifting the culture from sickness to health. Before we dive in, please remember that this podcast is for educational purposes only and is not a substitute for medical advice, diagnosis, or treatment. Always consult your healthcare provider before making any changes to your health routine. Welcome to the Body Ethos Podcast, where we're all about shifting the culture from sickness to health. I'm your host, Jessica Whitmell, and today we're diving into a foundational but often overlooked topic, which is a huge part of root cause healing, which is the oral microbiome. Today, we're going to be talking about what's happening in your mouth and how it's influencing your gut, your immune system, your metabolism, and even your nervous system. Our guests today are the founders of The Mouth Lab, a clinical oral microbiome company focused on bringing science-backed, personalized, and biologically aligned care into both the dental and functional medicine spaces. I am so excited to have Angelina, the co-founder and clinical director of The Mouth Lab, as well as Jazmin, the co-founder and research director of The Mouth Lab. Today, we're going to explore how the mouth acts as a gateway to systematic health and how the oral microbiome and oral dysbiosis may be a missing piece to chronic symptoms. So let's get started. So excited to be here today.
Thank you for having us. We're excited to be
thank
here.
you so much for having us.
Yeah.
Yes, excited to share the message with all of your listeners.
Absolutely. I know we met in real life and we just, exactly. So it's so fun to have this official chat and to share this with everybody else. So Angelina, I would love to start with you. I would love for you to share a little bit about the story of the Mouth Lab as well as your passion for the microbiome, especially the oral microbiome, and what led you into biological dentistry, and then really finding that this was a missing piece for overall health.
Yeah, so I've been in dental hygiene for over 20 years now, and I've always been really passionate about getting people healthier. But when I graduated from school, I was like, yes, I'm going to go out there. People are going to get healthier. Their teeth are going to look nicer, brighter, whiter. But not long into my career, I was like, hey, this is actually not what's happening. I kept telling people, brush more, floss more, you're not doing good enough. And it was causing a lot of burnout, not just for me, but for my patients as well, because they're like, I'm doing all the right things and still not um I'm still not getting the results that I wanted. And I think that story is pretty familiar to a lot of patients and a lot of practitioners alike. And so I had stayed in that practice for like 14 years. And then my doctor was like, he was finally going to retire. And he's like, Angelina, you need to go look for another office. And so I stumbled upon this biologic office. And I actually didn't even want to go to the interview because I was like, they're going to be doing something weird. It's not like what we learned in school. And then I started looking more into it. And ultimately, I wound up taking the job. They had offered it to me. And I was like, okay, I can maybe get on board with this. And then I started looking into it more and more. And I was like, if I'm going to do this, I'm just going to dive right in and give it my all. And I'm so happy that I made that choice because what I actually saw in that practice was so different than what I had experienced in the rest of my career. My patients were getting better, they were getting healthier. And so that really changed my outlook for my profession because one, it was more rewarding for me to see my patients get healthier and get better. And two, it was more rewarding for my patients. They were like, great, it's not just the flossing, I'm doing all these things, but now I'm actually seeing the results. And that's really what we want. Everybody hates, the first words out of your patient's mouth are, I hate going to the dentist, and that's not the first thing you want to hear when you meet somebody. But I mean, I can understand why, right? Is they're sick and tired of hearing, do all these things. And then they come back, they're like, you still have gum disease, you have another cavity, instead of saying, hey, what you've been doing has been paying off. And so working from a biological or integrative standpoint it's the way dentistry was meant to be. And so kind of now in my career, I actually don't like to use the word biological or holistic because I think that can be kind of, off-putting to some people, or it can, be how I thought it was, weird in the beginning. But it's not really. It's just a different way of thinking that everything is connected and our systems are not separate. And so our medical, our dental industries have kind of made the body separate systems, but that's not how it works in real life. And so this working this way has really changed our outcomes. But just not how we think, but also the clinical outcomes that we can actually see and evaluate. And I think I'm just so happy about that.
No, thank you for sharing your journey. Two things that stood out to me was I think it's interesting how sometimes those things that are most in alignment for us that we don't even know are those things that we kind of are hesitant about.
Yeah,
And I think a lot of people can relate. So,
yeah.
it's funny how that always works, right? I was afraid to go on that date or afraid to go that interview, and that's actually what was meant for you. So I'm glad that you
Hmm.
took that leap and that chance, because now you're really sharing this connectedness of the body and looking at things from a whole systems perspective that you wouldn't before. And so I'm just so glad that this work found you because I think it is in alignment with who you are too.
Yeah, and I think it's important to
Totally.
dig
I agree
into
with
like
you, Jessica.
yeah, and I think Jasmine can kind of talk about that a little bit more too. But I think when you kind of dig into those things that you're afraid of or not sure about, Jasmine and I are both big nerds, and so we really like digging into things that we don't know about to learn more about it. And that's kind of what led us into our research. And yeah, I don't know. We just like digging and finding answers, getting to the root cause because there's so much surface level work, and we can get into that really just surface level treatments because we're busy. We got thinking about like what's next on our calendar or the next patient coming in. But if we really like slow it down, think a little bit deeper about this, and really look at the bigger picture, like what's going on, then we can see. We'll see the bigger picture, get clearer answers, and get the results that we're looking for.
Absolutely. And I love that whole person approach and taking time with the patients. I know I do that in my practice too, and it makes a huge difference. I think people are looking for that different level of care, right? So, Jasmine, I'd love for you to kind of talk about, I think a lot of people, Angelina was saying, like, when they think about oral health, they think of your teeth and your gums. They're not necessarily thinking about how the oral microbiome communicates with the rest of the body, especially in terms of the immune system, inflammation, somatic conditions in the body. Could you speak a little bit more about that?
Totally. I mean, it's one of, like we said, is one of the most overlooked areas of your body, but it's one of the areas that is impacting the rest of your body actually the most. So I'll come at this from the research side and maybe Angelina can speak on the clinical aspect of it. But when I started digging into the literature of the oral microbiome, the thing that really shifted my thinking was realizing that the mouth hosts the second most diverse microbiome in the body after the gut. So over 700 species of bacteria, archaea, fungi, and it's not a closed system. So everything that's happening in the mouth has direct access to the rest of the body through the bloodstream and through what you swallow. So what the research keeps pointing to is that the oral microbiome is influencing the body through three main pathways. There's immune activation because the gums are so vascular that any inflammation there is essentially a 24/7 input into the immune system. There's also systemic inflammation because certain oral bacteria, they don't stay in the mouth. They travel through your bloodstream again and you swallow them all day long. So we're finding them in cardiovascular plaques, in brain tissue, in the placenta. And there's a connection to specific systemic conditions, like cardiovascular disease, Alzheimer's, diabetes, even autoimmune flares. So that's what really got me hooked on this work because as a researcher, you can see that the mouth keeps showing up kind of as an upstream driver in these conditions that we usually treat way downstream, and almost nobody's looking there.
Yeah,
Yeah, absolutely. I mean,
I think we can all say that we've heard our hygienist or our dentist say, "Oh, you have a little gingivitis or you have a little bit of bleeding."
Mm-hmm.
And that little bit of bleeding is the sign. It's the sign that it's already happening. The breakdown is already happening in our system. And so it's not just a little bit of bleeding or a little bit of gingivitis. Those are the big red flags waving right in front of our face. Hey, dysbiosis, breakdown, inflammation is going on and they shouldn't be ignored. We're so used to, and I don't know if this is from commercial marketing or what the case may be, but gingivitis is just, it's a term that we've all come
It's
accustomed
normalized.
to that it doesn't really mean anything right now. Leaky gums, is leaky gums or gingivitis. And if somebody said you had leaky gut, you would be like, oh my gosh, what is going on there? But it's the same thing that's just happening in our mouth. That breakdown is happening. We're just not used to looking at gum tissue as immune tissue.
Yeah, and truthfully, if you had any other part of your body that bled every single day, you probably would pay attention to that. But again, we've made it so normal to be in the mouth that we don't think about it. But yes, it's bleeding every day. Something's wrong.
Yeah, no, I think that's, I mean, it's again, it's reframing something that's been so normalized, whether that's just, marketing or just, something that we're just not thinking or taking a serious look at our mouths. But I think to your point, these things are connected to deeper issues that are happening and kind of these things that all of us want to avoid: Alzheimer's, cardiovascular disease, autoimmune, and it's all starting here. So Angelina, I'd love for you to talk about that gut body connection because I don't think people, again, like Jazmin said, we're swallowing our oral bacteria. And that is a really gross topic if you think about it. I don't think a lot of people are thinking about that. It's something I talk to my colleagues about. Like, you should be brushing your teeth in the morning or you're going to be swallowing everything that was festering overnight. So could you explain how these imbalances really do impact the gut and potentially keep people stuck in digestive issues, even beyond things like cardiovascular disease and things like that? But how is this leaky gums contributing to maybe leaky gut?
Yeah, so that's true. So we do swallow a ton of bacteria every single day, but under normal circumstances, our gut was designed to process those bacteria. So in a healthy environment, we shouldn't be finding those oral pathogens end up on the other end. But when your GI tract is not healthy, then we do find those oral pathogens like on the other end. Like if we look at stool tests, a lot of times we'll see those oral pathogens, those Fusobacterium nucleatums or Fusobacteria types of bacteria or the Prevotella types of bacteria in that stool, and they shouldn't really be ending up there. They should be processed, in the stomach acid or somewhere down the line. And so those same bacteria that cause tissue to break down in our mouth are going to also cause breakdown in other areas of the body. Um, the mouth gets overlooked as part of the GI system all the time. A lot of times we go to different events and they'll have images of the GI tract, and for some reason it starts like right about round here, around your esophagus, and the mouth is just like totally cut off the picture. I'm like, what happened to the mouth? That's literally where your digestion starts, where your food breakdown starts, and it gets just eliminated. I don't know how that happened, but we're all on the same page there. So that's what the mouth lab wants to do is just bring the mouth back into that picture, say, hey, this is where digestion starts. If we have a healthy microbiome to start, it's so much easier to get the rest of the GI tract healthy. We have so many patients that come in with different GI issues, IBS, IBD, SIBO, things along those lines, and they're doing all the right things. They have the great diet. They're following the different protocols from their physicians or functional doctors or health coaches, but they're just not quite getting the result that they want. And a lot of times it's because the mouth is overlooked. And if we're not starting with a healthy microbiome at the beginning, at that front entrance door, then it's very difficult to get it healthy somewhere mid-road. And so that's one of the reasons why we do recommend salivary testing, or there's other testings that we do as well, but salivary testing to start with, so we can see if there's dysbiosis happening in the mouth. That way it can be addressed.
Yeah, no, I think that was a great summary and something that, something I talk to my clients a lot about is chewing and how we actually release enzymes in our mouth to start breaking down digestion. But, that oral microbiome piece is just as important because that's the start of our entire, digestive or microbiome as well. So I love that. So we kind of talked about digestive issues and how it's linked to a lot of these conditions that a lot of us are trying to either get well from or avoid. But I know a lot of people too are dealing with weight gain and type 2 diabetes or pre-diabetes diagnoses. So Jazmin, I'd love for you to talk about blood sugar regulation and how that's actually connected to the oral microbiome. Because what I see in my clients very often is that they have blood sugar dysregulation and insulin resistance, and they're eating clean and they're, walking and doing all the right things, but they're still dealing with that blood sugar dysregulation and how this might be the missing link for people to improve their metabolic health.
Totally. That's such an important question, I think, because it's actually one of my favorite topics because the data on it is actually impressive. Most people have never really heard about it, but the research shows that chronic gum inflammation releases those inflammatory cytokines, so things like TNF alpha, IL-6, right into the bloodstream. And so when those cytokines directly interfere with insulin signaling, and so there's studies that show that treating periodontal disease can lower A1C enough to be comparable to adding a second diabetes medication just from cleaning up the mouth. So, and what's interesting about it, it's also bidirectional. So that's the part that I really want listeners to hear, because bad gums not only make blood sugar worse, but high blood sugar makes your gums worse. So people are really stuck in this loop and they don't even know they're in it. So from a research lens, what makes this so important is that somebody could be doing everything right, like you said, could be eating clean, exercising, supplementing, and still not moving the needle because their mouth is just dumping inflammation into their system around the clock. So we see this clinically all the time, but the data backs it up completely. The way I think about it and the way I tell my patients is if your gums bleed, your blood sugar's hearing about it.
From a diabetes point of view, it's very hard to achieve that healing. And when we want patients to, in traditional dentistry, when we want patients to do better, a lot of times we're prescribing like harsh antimicrobials or antibiotics, which can further cause dysbiosis in that oral microbiome. And so maybe even though our intentions are really good, we're not going to be able to achieve those results because we're just moving that oral microbiome further into dysbiosis. We might get a short-term result. For the long term, the metabolic dysfunction is a long-term issue. And so when we're thinking about addressing this from a long-term standpoint, we really need to talk about getting that oral microbiome into a more symbiotic environment and addressing the underlying causes. It might not all be bacteria. Are there viruses or other issues that are contributing to that imbalance, that are modulating that immune system? And so if we can address those, then we can kind of build on getting the bacteria balanced, but also, we're never going to live in a sterile environment. We're always going to be exposed, whether it's partners or kids or pets or whatever the case may be. So we need to make sure that we're building that immune system. That way, when you are exposed to these pathogens, your body is able to fight them off. And I think that that is one of the biggest missing links when we're thinking about how are we going to address this bacteria from a long-term standpoint.
Yeah, it's all about building that resiliency in the body so we can have that optimal health long term, right? It's all about maintaining. It's not just about these kind of short term gains. So I love
Yeah.
that. I think two things that stood out to me so far from what you guys have said is if your gums are bleeding, your blood sugar is hearing that, and leaky gums, leaky gut. And I feel like if people can get that in their mind, I think we can all start to kind of take our oral microbiome a little bit more seriously. So I absolutely love that. Jazmin, I'd love for you to talk about how, and Angelina kind of, addressed this a little bit already, is that a lot of times kind of like standard care is like heavy antimicrobials, heavy antibiotics, kind of going in there and nuking the system. But could you talk about, especially from antibiotics perspective, why that's probably not the best approach and how you guys do your protocols a little bit differently?
Yeah, so, we're not antibiotic. They definitely have their own place and they matter in certain situations. But what we noticed is that, especially in reducing these oral pathogens, a lot of the research that's out there and a lot of the testing companies that are out there, they recommend primarily antibiotics to remove the bacteria. Our patients, wanted something different, and they were actually a big part of what drove us to dig deeper, because they were wanting different answers, because we all know that overusing antibiotics can't be helpful for anybody. You can't really completely nuke everything out and expect things to go back to normal. You can't antibiotic your way to a healthy ecosystem. And the literature on gut health figured this out actually years ago. So that same principle applies in the mouth. When you wipe out all that bad bacteria, you take the beneficial ones with them. And what grows back first is often worse. So when we were building our protocols, the question we kept asking from a research standpoint is, what does the data actually support for rebuilding that ecosystem instead of sterilizing it? Because we noticed that if we give our patients an antibiotic to remove that bacteria, what happens when you're exposed to that bacteria again? Because that bacteria can come from different sources. It can come from people in your life that you share saliva or food or drinks with. It can come from your pets. And so it's a lot of sources that we can't particularly control. And so in our point of view, if you wipe them out completely, what happens again when your dog licks your face, or when you share saliva with somebody that doesn't have their microbiome balanced? So it's important to us to make sure that we foster an environment for those good bacteria to grow, for them to thrive, and for your body to be strong enough to be able to fight those bacteria off and to destroy them properly. So, the tools that we use have really strong evidence behind them. We use a lot of probiotic therapies, ozone and laser therapies to be able to support that system. And also salivary testing, because it's definitely very important to measure where you started, where you're going, and how the treatment that you're implementing is working. So again, we're just pro ecosystem, trying to create that perfect environment for those bacteria and building that ecosystem. And when you do that, you rarely need an antibiotic.
I think too, maybe just to add to that, is sometimes like antibiotic is not maybe just a pill. It can be killing off that good bacteria with all the best intentions. That mouthwash that kills 99.9% of the bacteria, that's also killing the good bacteria. Or even like natural essential oils or ozones, even though those are things that we really love and there's a time and a place for them, if they're overused, those can also be causing more harm than good. So we got to just be aware of what we're using, how often we're using it, why we're using it. Just because it says it's good for this, that, or the other, let's make sure that it's something that you need for your body.
Totally.
Yeah, I actually have a personal testimony of that. I used a very heavy antimicrobial toothpaste, and I actually started getting a cavity at my next appointment. So I was actually killing off too much beneficial bacteria.
Yeah.
Too much of a good thing, right? Even though I was doing the right thing with trying to get the
Yeah.
bad, I wasn't debating the good. Yeah, that was a good lesson to learn.
Yeah, it's such an important piece to it. Totally.
Yeah, exactly. So I think, for people, so there's a few things that I want to talk about here. Just Angelina, could you talk about, I know you guys are all about research, which I really, really, really love. I love that you guys are so research-based and science-backed. Could you talk a little bit more about your pilot study you did about the oral microbiome and how you saw benefits for both oral health and systematic improvements?
Yeah, so we did a short pilot study because we were seeing these really good results in our clinical practice. And so we wanted to get this information out to the rest of the world. So it's under peer review right now. But what we had found was that it's very reproducible. We can get these good improvements. And so in our clinical practice, we were using bunches of adjunct therapy. But in our study, we wanted to see what a systemic probiotic could do alone. Could it produce the same effects that we were wanting? So reduced bleeding on probing, reduced clinical pocket depth all by itself. And so there's a lot of different probiotics that are out there on the market right now targeted for oral health, but we chose a different probiotic. We chose a bacillus-based, spore-based probiotic. And the reason why we did that was because We knew already that the mouth was part of the immune system, right? And it was part of the GI tract, and it was part of every other system in our body. But we weren't treating it that way. So the other probiotics that are on the market are usually they're like little lozenges. You suck on them, you're supposed to get the effects. But we know that that's not how our body works. And so we needed a probiotic that was going to address that systemic bacteria. And so the bacillus spores really did that. They don't just go in there and it's not just like adding a bunch of bacteria into the system. What it's doing is it's changing the environment so that the good bacteria that you have can actually thrive. And so it was a 12-week study, but it was in that short amount of time, we were able to reduce bleeding by over 98%. We were able to reduce mostly all of the deep pocketing, so nothing deeper than 4 millimeters, which is considered to be within normal limits in every single patient. So there were 6 patients in the study, and they all received, so before we started the study, none of the participants had reported GI symptoms. But after the study, when we were doing the exit interview, they all had reported that their GI health seemed better than before. And so that was always really interesting to us because sometimes you don't know you're not feeling good until you're feeling better. GI health is just kind of one of those things, unless you're like really suffering, sometimes people just think it's normal.
Absolutely. Yeah.
Yeah, and one of the things that really helped us kind of really think about why we wanted to test this probiotic, even before we decided to do a formal research study on it. We were talking about leaky gums and how that actually mimics leaky gut. Those junctions in the gut that break and become, that cause that leaky. Those same junctions are in your gums, and that's how that bacteria has direct access to your blood. And so that was kind of what we really wanted to prove in a sense, or start the conversation on, is if we modulate the gut symptoms or the gut itself, can we see those effects in the mouth, since again the mouth is the start of the GI tract. And yeah, I think the results were actually quite promising. And what's really cool is that we didn't just see this in the 6 patients that we took for this study. Just wanted to highlight that for the study, there was nothing else that changed in their oral care routine. We didn't prescribe any medicated gels or anything like that. It was just a regular cleaning and the probiotic therapy that we put them on. And I think that was like actually the most exciting part about it all, is that, it wasn't something that you put in your mouth that made the difference. It was something that you ingested and something that treated the whole system that actually had that impact in the mouth, which I think was exciting to see because it was what we were seeing already clinically, but it was so cool to be able to prove that with research. So I'm really excited for that to come out, for people to finally be able to see that information, because I think it really starts the conversation and it really changes how we talk about gum health and oral health.
You had brought up an interesting point because, we talked about earlier how we swallow all of these bacteria, but I think it often goes ignored that the bacteria actually have an alternate route into our system, and it's via those broken blood vessels. Yeah. So when you see bleeding in your mouth, that's an open blood vessel where those bacteria have direct access into your blood system with a highway right to every other organ in your body. And so those bacteria have been found in atherosclerotic plaques. They contribute to cognitive decline. Every other disease, inflammatory disease you can think of.
Colon cancer.
Yeah, in the uterus. Yeah. There's a lot of other inflammatory diseases that are, or conditions that are associated with oral health. And so it doesn't have to just be swallowed there. If your gums are bleeding, or, it's a free for all.
Yeah. And I think that's really important to highlight to listeners, is that, it's not just like what we're saying is a correlation. No, these bacteria are being found in these places, right? So they're found in the placenta of women with adverse pregnancy outcomes or low birth weight. So that's what's really important. How are these bacteria traveling to all these other areas of the body? They're getting access to your brain, your gut, your every system in your body. And that's just what we know now. I know the research is still emerging and still being developed on the oral side. So definitely, I can anticipate it probably being found in other places that we don't know about yet.
Yeah. And I think it's important to note that these are not like, we're not saying that these oral pathogens cause any of these diseases, but they definitely do. They're contributing factors. And so, we just want to make sure that, diseases or inflammatory conditions are usually multifactorial. And if we can address one of the causative factors, from that's coming from the mouth, that's going to make it so much easier to collaborate with your other health professionals to address the other issues going on.
Yeah, absolutely. It's never just one thing. It's always a combination of things. But if we're missing one of those key factors, like the oral microbiome, we're missing a huge link to that puzzle, or a missing puzzle piece, rather. Absolutely
Right.
love that. And so impressive about your pilot study, just the results that you got with that systematic improvement and that systematic probiotic therapy. I love spore-based probiotics, so I love them even more now, learning more about this pilot
Yeah.
study of just how far-reaching effects are. And I think it is one of those things where, Angelina, you're talking about how people normalize their gut dysfunction. I'm a little bloated. Oh, I get a little bit of, acid reflux. That's only after pasta, those types of things. And really, I think we're not always listening to our bodies. That leads me into, what are some signs of oral dysbiosis that people shouldn't ignore? Because it sounds like, I think a lot of us like to tune out of what may be going on in our body, or not, we're not as tuned in. So what can people tune into to, get an understanding of how their oral health is?
Yes, so this is the question I really want listeners to lock in on, because from everything we see in the research and everything we see clinically, there are signs that the body is giving that they've been told are normal, and they're not, as we've talked about. So the big one is, again, bleeding gums. When you brush or you floss, that's not sensitive gums. That's not you brushed too hard. That's inflammation, full stop. Other common ones are chronic bad breath, a white coating on the tongue, recurring canker sores or cold sores, gum recession is a big one, frequent cavities, even though your hygiene is pretty good, or a metallic or off taste in your mouth. But what I really want people to hear is that there are systemic signs too. So things like bloating that won't resolve despite gut protocols, brain fog or inflammation that you can't really pin to anything, even waking up with a really dry mouth. So if you've been chasing your gut health or your hormones, your skin, your energy for years and nothing's really sticking, the mouth may actually be the piece that nobody has looked at. So
Yeah.
we actually created a guide for your listeners, Jessica. It's 5 signs your mouth is driving your gut issues. So you can grab it at our website. I'm sure you will link it for your viewers and your listeners. And it just walks you through those practical signs, and it gives you any next steps to take a look at. And if you grab it, then we'll send you an email with a coupon for you to do your first saliva test. So I'm very excited about that.
Yeah, awesome. Yeah, thank you for going over those common signs. I think it's so important. And I'm always about testing, not guessing. That's why I love using the stool testing that screens for oral microbes in the gut. And I always have conversations with clients when that comes up. But I do think doing that deeper salivary testing is important as well. And so, Angelina, I'd actually love for you to talk maybe a little bit more about that. Can you explain how the saliva can actually give us deeper insights, and how even beyond standard blood tests or stool testing?
Yeah, so we love looking at the blood chemistries and the stool tests for our patients that come to the mouth lab as well. And it's not just us, but when was the last time your hygienist asked, like, "Are you going to the bathroom?" at least once a day? You know, oftentimes patients are like, oh my gosh, why is my hygienist asking that? Or why is my hygienist asking about my stool test? But I really feel that every hygienist should be looking at a stool test or a salivary test, some sort of deeper level of testing. Look at those blood chemistries. What's that CRP? What's that A1C looking like? What's the vitamin D looking like? Because all of those tests give us really good insight into what's happening in the mouth and how the mouth is affecting the rest of the body. I think I got off track. But if sometimes coming from a dental perspective, clinically, it can be a big jump for a patient to be like, why is my hygienist asking for a stool test? And so a lot of times we would start with a salivary test. And so depending on which type of salivary test you're getting, that can give us a lot of good information, whether it's one of the salivary tests that's a little bit more basic or one of the salivary tests that offers us a ton of information. Even if we're getting just the high risk pathogens, that's going to give us at least a good starting point. And so that's kind of what we've noticed is usually we start with a little bit of testing to kind of give us a little window what's going on. And perhaps it may lead to more testing down the road. Maybe it's further salivary testing, or maybe it is a stool test or some blood chemistries. But we need to, kind of dive in, dig a little bit deeper and see what our body's telling us because everybody's a little bit different on, symptoms are so subjective, right? What is extreme to one person, the other person may not even notice. And so if we can get some hard data, it not only gives us a window, but it gives us a starting point. And I always prefer a pre and a post test and probably some testing in between to make sure that what we're doing, what we're recommending is actually working and it's making a difference. And if it's not making a difference, then we can pivot and adjust because health is just not static. It's never going to be the same. Our diets change, our lifestyle change, our surroundings change. And so we have to be a little bit fluid and flexible enough to kind of, be able to bend and make some adjustments and changes and kind of be open for that because something that may be working now may not work in the future for you. Or, there's a lot of different things. We're constantly changing, not just on the inside of our body, but on the outside too, physically, mentally, we're not the same people that we were, 5, 10, 20 years ago. And so it's really important to kind of keep that in mind with our health too. We want to consistently be striving for better. So, even with our testing, testing has come such a long way. The testing that we're doing now is not the testing that we were even doing 5 years ago. And so we want to make sure that, as science changes, as we keep learning, finding out new things, that we're constantly evaluating our protocols and our procedures and making sure that we're growing. We don't want to keep practicing the same dentistry or the same medicine that we were practicing, even a few years ago. We were lucky enough to live in the time where we have access to all of this. And so let's use the tools that are out there.
Yeah, well said, well said. I think that that's the same in the functional medicine space, right? Like we have so many new tools now and we have so much more research to understanding how human health is not just segmented into different disciplines, right? And so
Yeah.
I love that you guys are, sharing this message and providing some really good information in this podcast today. So thank you both so much. As we
Thank you.
Yeah, of course. And as we close, Angelina, I'd love for you to answer this question. Jazmin, please lend your voice to this as well. But I always ask this of my podcast guests because, as you know, the Body Ethos Podcast is all about shifting the culture from sickness to health and helping people take meaningful steps in their health so we can ultimately shift that culture. So, what is a few simple but even practical things that people can start doing today to help shift their oral microbiome to a healthier state?
One of my favorite things is looking at ingredients. So whatever product you're doing, take a deep dive, look at your ingredients, go on your favorite AI platform and see what those ingredients actually does. Look at SDS forms. Our mouth is like a sponge. So if you think about even there's certain medications that are designed to place underneath the tongues to be absorbed. And so your mouth is going to absorb all of those ingredients that are in the products that we're using. And so be very careful about what products you're using. Make sure you feel comfortable with all of the ingredients that you're using in the products. And then definitely get a salivary test, because a lot of times people say, well, can't I just use XYZ and get the result? And, maybe you can, but we don't know where you're starting. And so if you're not getting the result that maybe you were wanting or expecting, it's because maybe you were way worse than we had thought, or maybe it's not what you needed. And so testing is so important because you can really just personalize the products and supplements and diet that's for your body.
And I have one to add. It's ditch the antiseptic mouthwash because it's destroying your microbiome the same way an antibiotic does. Definitely, it's one that you can start implementing today. If you have a mouthwash, just think twice before you use it. I won't say never use a mouthwash, but the less you can use it, probably the better for your mouth.
Thank you both. This was such a wonderful discussion. Thank you for your passion in this work, and just for helping the listeners today understand more about how foundational the oral microbiome is when it comes to overall healing and overall health. So if this episode resonated with you, I hope that you don't keep it to yourself. Subscribe, leave a review, share it with someone who's trying to heal, and this might be their missing piece. And if you want to learn more about Angelina and Jazmin and the Mouth Lab, their links will be in the show notes. So please follow along on the awesome work that they're doing. And again, if you have been stuck trying to do all the right things with your gut, your hormones, your energy, your weight loss, all of that, this may be your missing link. So please dig into this information more and take some of these lessons that we learned here today. And until next time, I hope that you stay curious, stay empowered, and we all just keep shifting our culture from sickness to health little by little together. Thank you, guys.
Thank you.
Thank you so much.